This video is for general information only and does not replace advice from your own healthcare professional. Always speak to your GP, pharmacist, or diabetes team for personalized guidance. Can Mounjaro cause diverticulitis as a side effect? It's a question we hear quite often, so let's look at what the evidence actually shows. Currently, there is no established evidence linking Mounjaro to the development of diverticulitis. But because this medication does affect your digestive system, it's worth understanding what we know and what to watch for. Mounjaro, or tirzepatide, is a dual GIP and GLP-1 receptor agonist licensed in the UK for type 2 diabetes and weight management. It works by mimicking hormones in your body that regulate blood sugar and appetite. One of the ways it does this is by slowing down how quickly your stomach empties. This is actually part of how the medication works, but it also means digestive side effects are quite common. So let's address the diverticulitis question directly. Diverticulitis is inflammation or infection of small pouches, called diverticula, that can form in the wall of the colon. Based on clinical trials and ongoing post-marketing surveillance, diverticulitis has not been identified as a specific adverse event linked to Mounjaro. The large SURPASS clinical trial program, which studied tirzepatide extensively, did not flag diverticulitis as a concern. That said, Mounjaro does commonly cause gastrointestinal side effects. These include nausea, diarrhea, vomiting, and constipation. These happen because the medication affects gut motility, essentially changing how your digestive system moves things along. Now, if you already have diverticular disease, that's something you should definitely discuss with your prescriber before starting Mounjaro. Your gastrointestinal history matters. Your doctor needs to know about any pre-existing digestive conditions so they can help you monitor your symptoms appropriately whilst you're on treatment. There are some practical steps you can take to support your digestive health whilst taking Mounjaro. Staying well hydrated is important, so make sure you're drinking enough water throughout the day. Adequate fiber intake also matters for keeping your digestive system functioning well. And pay attention to your bowel habits. If you notice significant changes, that's worth mentioning to your healthcare professional. These aren't special requirements just for Mounjaro. They're good digestive health practices for anyone, but they're particularly sensible when you're taking a medication that affects gut motility. Let's talk about when you should seek medical help. You should contact your doctor urgently if you experience severe abdominal pain, especially if it's persistent or getting worse. Fever combined with abdominal tenderness is another red flag. Blood in your stools should always be checked out promptly, and persistent vomiting that won't stop also warrants medical attention. If symptoms are severe or you're unsure, contact NHS 111 or call 999 in an emergency. These symptoms could indicate various conditions that need assessment, not necessarily diverticulitis. But they're signs that something needs medical attention regardless of what medication you're taking. It's also worth remembering that the MHRA and European Medicines Agency continue to monitor safety data for all GLP-1 receptor agonists, including tirzepatide. If new safety signals emerge, healthcare professionals and patients are informed through official channels. The key thing to understand is that whilst Mounjaro does affect your digestive system as part of how it works, there's currently no evidence linking it specifically to diverticulitis. The digestive side effects that do occur, like nausea and changes in bowel habits, are well documented. If you're considering starting Mounjaro or you're already taking it, have an open conversation with your healthcare professional about your digestive health. Tell them about any existing gastrointestinal conditions, discuss what's normal for you and what changes you should watch for, and never hesitate to reach out if something doesn't feel right. So to recap, there's no established link between Mounjaro and diverticulitis based on current evidence. Digestive side effects are common with this medication but are usually related to how it affects gut motility. And maintaining good hydration, adequate fiber intake, and monitoring your symptoms are sensible approaches whilst on treatment. Always speak to your healthcare professional for advice tailored to your personal medical situation. They know your health history and can guide you appropriately. Have you experienced digestive changes on Mounjaro? Share your experience in the comments. And if you found this helpful, give us a like and subscribe for more evidence based health information from Bolt Pharmacy.